In terms of community transmission, that you can see here across all of the districts in Alabama, everything's looking pretty good. All districts are coming down pretty steadily. We are getting some cases reported last week so it looks, if you look at any tracker other than ADPHs, it may look like we had a bit of a surge. But again, those were cases that were from earlier in the pandemic, but were only just reported last week. I think it's always helpful to look at the curves and kind of remember what this one looked like versus other curves as we think about what's happening next, both in terms of the length of the valley and the height of the peak. In the weekly snapshot that I present every week at the COVID command, you can see all of the key metrics that we track are down. The weekly cases in Jefferson County, Alabama, and among UAB faculty and staff. And again, it's really interesting that it's pretty consistent that what we see in students, faculty, and staff is about 2 to 3 times higher than the community levels. So really probably this is a good estimate of the actual disease burden, since we're mandatory reporter and we have good access to testing. So the next question that always comes up is, how are we going to manage now that it's endemic? And the key is to knowing what the word endemic means, which really is just the constant presence. It's that baseline level when you've got a disease that never really goes away. And the key is that we have to be able to define that baseline level so that we know when we need to jump into epidemic outbreak containment. And what CDC has come out with recently is that we're going to be looking at hospitalizations and case rates more, although I do think we should still keep looking at case positivity. When we're in an endemic place, we have to think about minimizing consequences for the infected, and that's really our vaccine program and medications that are available to treat the disease. But then I think as a public health group too, we want to be able to identify those surges early so that we can do non-pharmaceutical interventions in a timely manner and minimize the height of that peak. In terms of looking at how it's evolving, this is the number of hospitalizations for these 3 big peaks that we've had, the Alpha, Beta, Delta, and Omicron. Interestingly, Alpha and Beta had roughly the almost exactly the same slope coming down the wave, but Omicron's been much more steep. And this is, I just picked this point. If I would have picked earlier, you would have seen an even steeper decline. But yeah, if we look at the 1500 and down, you can see that we're really sliding down the wave much more quickly, and we're coming down lower than we did in the others. So again, when we're thinking about what endemic means, it was more like 250 to 300 hospitalizations with the first 2 waves, and now we're already down around 200. So we may level out at 200 or less with this particular valley from the wave. In terms of the time in between in the valley, I think that's another important thing for us to consider as we're looking at BA2 and what might come next. We know coronaviruses will circulate independent of season, that lasting immunity is not very common with coronaviruses and could be as short as 3 to 6 months. We know that surges tend to happen when the population immunity is low or the virus mutates. And so as we have those facts to kind of keep with us, we can look at what happened with Alpha Beta. And with Alpha Beta, we saw a valley of about 5 months from March of 2021 to July of 2021, and Delta ended that valley. Then the Delta valley, between Delta and Omicron, we were really October to mid-December, so we were only 2.5 months in that valley. And again, a mutation, Omicron, ended that valley. So in terms of general surveillance, our cases are low here in the US. This particular site on CDC's website helps you to look at percent change by county. And here are these darker blue ones are the ones where we kind of say, okay, you know, we're seeing Kentucky with a little bit of growth, Minnesota and Nevada. So something worth watching. Then globally, we can again look at who's changing, and we're seeing a lot of change in Europe. If you hover over this, when you go to the CDC website, you can see how much it's changing. And Germany, for example, only enjoyed a little bit sliding down, and now they're going right back up quite quickly. So same with the UK. They had a small slide down, and they really are aggressively climbing again. So we can see that Western Europe has new cases. Australia also is having some new cases. Thailand and Vietnam are also experiencing pretty big surges, in Brazil. So worth watching as we continue to move forward. The vaccination continues to be very effective. We now have the Omicron data, so we can look at cases. This is, to me, one of the most impressive things to look at. If we look at cases by vaccination status and then flip to deaths, and watch how those curves widen. I mean, the vaccine really does keep people from dying. And later on, you can also do this with the boosters. So you can see what about a full regimen versus a boosted regimen. And the boosted regimen is the dark blue, and you can again see there are big differences. Not as dramatic as unvaccinated, but still big differences. Wastewater is probably the next big area that we're all starting to track, because there are places like Boston that have been tracking wastewater data since really the beginning of the pandemic. And these surges have been able to, the wastewater bump up in SARS mRNA, SARS-CoV-2 has really been before the big surge. And this is the data that comes from Athens, from the University of Georgia, where they're tracking Athens sewage water or sewage and mRNA. And this is the one that I hope we can be someday if we start doing some tracking. You can see here where the amount of mRNA in the sewer system starts to pivot long before cases appear in the population. And this also happened for Omicron. Here's that pivot point again, and we don't see Omicron until much later. So I'm hoping that someday we can do something similar here, because this will help us with that early detection. But currently, the one that we have to monitor is CDC's. This one's a little bit harder to follow because it's really tough if you don't know baseline to understand what these percent changes mean. If you're at baseline, and so you're at, just 5 or 10, I'm just picking a random number, and you jump up to 50 or 1,000, you see these big changes, but maybe the important point is 10,000 or 100,000. And we can't tell that just by looking at one point. I mean, we really need some data that looks more like this. So hopefully we can move in that direction here as well.
I'm going to show you some data from the CDC website, and they use this Nowcasting feature, which basically, because it takes 2 to 3 weeks for you to get data from the sequencing, they collect the samples and then they have to go, in the queue and get sequenced. So, that data is always behind. So they're trying to use this Nowcasting system to estimate what's the current proportion of the different variants out to, where we are now, rather than knowing 2 to 3 weeks, behind. So what they're doing is this kind of thing, and they're also using sample weights and sort of spreading it out over geographic areas. And in their experience, they say that when the sequence data comes in, it really matches up quite well with what their Nowcasting feature is doing. So here's the United States in terms of, what's really circulating. As you can see, Delta's kind of history at this point. The original Omicron is the BA.1.1, and now we've got the BA.2, which, as you can see in the sort of pink color, is coming up. And this was all over the news this week, when the estimates were that it's now at about 23% of cases. So if we want to look at regions, and now the region for Southeast is Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee. So we're a bit behind some other regions in terms of what's happening with this new BA.2, son or daughter of Omicron, if you will, variant. It's not as prevalent here at this point, but is coming along. If you look in the CDC website, the big places in terms of having a lot of BA.2 are the Pacific Island territories that we have, and Rhode Island, for whatever reason. There's a few places. Alaska, for whatever reason, has a lot more BA.2. So you can see here sort of how things break down in terms of where BA.2 is most common, and it looks like now it's up in the Northeast and coming along out in the West. Us folks in the middle of the country are usually doing our usual thing, like with hemlines and everything else, we're a little bit behind. What's going on elsewhere is not comforting. So the cases are rising in 29 countries worldwide. The most new infections on a daily, basis, how many new cases per day are being experienced: South Carolina, Vietnam, or South Korea, Vietnam, and Germany. There are other countries, and Germany's setting records, more than 250,000 new cases a day. Other countries in Europe, about half the EU, are seeing increases in their case rates. These countries, Austria, Liechtenstein, if you want to go, to that banking haven and check on your offshore account, don't. Isle of Man, Finland, France, these countries in Europe are at or near their peak for the whole pandemic. Denmark rapidly shot up and then sort of hit a peak and is now receding very quickly. When you see a variant come along, this is the experience to date. When the variant passes 50% of cases, that's when it really starts to drive the train. And that's what's happening now in Germany and the UK and a few other countries. We tend to be some weeks behind the UK in terms of what's happening. And so, the question now is, well, what's happening with that and with these places where, they're seeing new peaks? And as Suzanne was talking about, other countries that are experiencing a lot of new cases include Australia and New Zealand. China's shut down, a whole province. So, we're not really sure. The speculation is maybe it's this BA2 coming on, waning immunity from people who might have gotten, sick last summer. And then, of course, lots of places are relaxing their non-pharmacological mitigation measures like masking. The UK is now experiencing sort of a weird trend. As the experience has been, hospitalizations are a lagging indicator, and they're not at this point. They're not lagging the cases in the UK. Their hospitalizations are shooting up about on track with the number of new cases daily. And this is in counterpoise to what's going on at the ICUs. Beds filling up in the ICUs is not really happening right now in the UK. So it's not clear why this is happening. And it could be that there's just a lot of stuff out there that isn't as severe and people are going in the hospital, but they're not as sick. And or there's just a lot of people coming into the hospital for whatever reason and they're being tested. And we don't really know what's going on with that in the UK, but it gives one pause that, there's a lot of new cases in a number of places going on. Relative to BA1, it's a little more likely to cause infection in household contacts. In Denmark, they hit that quick peak and then fell back down. Their folks are saying that they think it's 1.5 times more transmissible than BA1. And BA2 is overtaking BA1 in Denmark. So far, BA2 doesn't look to be more virulent. Again, the hospitalizations are going up in European countries, but not the deaths. Either they won't or not yet. Hard to know. Hard to know how this translates to the United States, since the European countries tend to be more vaccinated than we are. Vaccine efficacy for symptomatic disease, which is in the low 70s, appears to be similar as BA1. And of course, your immunity wanes over time, whether you get it by infection or vaccination. Prior infection with Omicron appears to provide some protection. That will probably wane. We don't know that quite yet. And in terms of, susceptibility to drugs and monoclonal antibodies, BA2 is looking similar to BA1, which you'll recall, some of the monoclonals did really not work with original Omicron. So we're, still going to be in that area where, some of the monoclonal products are just not going to cut it. So they're now considering a fourth booster. Submissions have been made to the FDA by both Moderna and Pfizer. Although I think Pfizer's was for the 65 and older crowd, and Moderna's going more wide than that with their submission. So I don't know, when we decide this is endemic, it's hard to know if we're going to be getting shots multiple times a year, or, what's going to happen.
This is the CDC metric that uses case counts, hospitalizations, and admissions. I think the figure that I heard today was less than 1% of the US population is now in an area of high transmission. We've got several of the eastern Kentucky counties that are, and a little bit of Oklahoma and Montana and Maine. But for the first time, since CDC started using this metric, none of the counties in Alabama are in the high transmission. Almost all are in the low transmission.